take a system-wide, system-deep lens, invest in the capabilities today that you need tomorrow, navigate your way through this. I can't see another way.
Hello, I'm Kumanan Rasanathan, and this is the Alliance Lift, the podcast that brings you closer to the people strengthening health policy and systems research around the world.
My advice to people is get into a complex health system, connect with the people that works there, become part of the endless range of possibilities it offers for making a better future and a better society.
Today, I'm joined by my very good friend, Dr Keith Cloete, Head of Health for the Western Cape Provincial Government in South Africa. Over more than 3 decades in public service, Keith's career has evolved from frontline clinical care into senior leadership focused on how health systems actually function, how services are organised, how decisions are made, and how evidence, communities and government come together to improve population health. He has led the Western Cape Department of Health and Wellness since April 2020, after previously serving as Deputy Director General and holding senior leadership roles across Metro Health Services and HIV, TB and STI programs. We've had the pleasure of working closely with Keith at the Alliance over many years, including through the Global Symposium on Health Systems Research and the Alliance's Policymaker Forum, which he currently co-chairs. Keith was recently recognised by Health Systems Global with the Sam Ajayi Distinguished Public Service Award. Keith, welcome to the Alliance Lift. It's so good to have you with us.
Thank you, Kumanan. It's a pleasure to be with you.
Let's look back for our segment called Learning from the Past. So Keith, you've worked in the Western Cape public health system since the late 1980s. You've seen so much in that time. You were there working already at the end of apartheid and that tremendous transformation. You've moved from clinical roles into senior management, and together with your colleagues at the University of Western Cape and University of Cape Town, you've coined this idea that you practice system-wide and system-deep leadership. If you think back to those early years in the 1980s working as a clinical doctor, was there a particular moment or experience that made you realise how much the wider health system shapes what clinicians can actually do for patients, and which perhaps led to the career path that you've taken?
As Kumanan, I very clearly remember the specific moment where that happened to me. It was actually on the back of a very sad clinical episode for me in the Mitchells Plain Community Health Centre. It is the busiest community health centre in the Cape Metro in Western Cape. I was very curious about maternal and child health, and I happened to be the go-to person in the facility for children that had specific conditions of concern. And there was an unfortunate spate of children going missing and children actually being killed by an unknown assailant, a serial abuser, whatever. I was the doctor where a lot of children were brought into the health facility for me to examine together with a social worker for alleged child abuse. And it was really tough work to continue seeing streaks of kids being brought into the health facility. After 2-3 weeks of doing this, it really struck me that up to that point, I saw a lot of people presenting something to a health facility that actually are driven by social determinants, which is way beyond the reach of an individual clinician within a consulting room. And I guess that episode set me off on a range of things to explore in terms of understanding. I didn't have the language at the time, but it's really understanding the social drivers for illness. And that got me going on this path towards health systems and what ultimately became my management career.
Well, Keith, I think many of us share that who are clinicians, experiencing these adverse social determinants, often the physical or the emotional abuse that people undertake, and the limitations of our clinical health work to address that. And so, across your career, you've led services at very different levels. And in the Western Cape, that journey has also involved moving from a more traditional managerial system towards something more adaptive. You're the epitome of a learning health system, as the Alliance would say. What did working at those different levels teach you about leadership, decision making, the kinds of evidence that are actually useful to people running health services, and to how to change culture to move towards a learning health system?
So this is a very interesting question because my immediate job following that direct first clinical job was actually to become a school medical officer. So my job was to go to schools and to work with people in schools, looking at the medical conditions that school children face that impedes their learning. So my first experience as a medical doctor, actually working in another government system, which was the education system, and then working with community structures, meeting with teachers, with families, with people working in local community structures, sports organizations, cultural organizations. That exposure led me to my first clear realization in management that you cannot actually work in public health or in systems work if you are not able to work in a space of adaptive governance and to provide adaptive leadership within those contexts. And what I mean by that, it was really just to work in relational work. I've built relationships with people that 30 years later, I still have personal relationships with them on the back of the work. So relational work, but deep relational work of meeting of purpose of people. And therefore, one of the things I really early on recognized that professional power was one manifestation of power. But really to equalize power in relationships is that I could equally speak as comfortable with a child that's helping another child or a teacher and remove power out of the relationships. Power was a very big potential impediment, but also a very big enabler for bringing people together to convening and holding a space that give people voice and agency.
One of the other things that's also struck us is how fluent you are, but also your whole team, right down to frontline health workers, are in concepts around health policy and systems research. Now, we know that, of course, you have benefited so much from living and working with colleagues from institutions like the University of the Western Cape and the University of Cape Town, which are such global leading institutions in health policy and systems research. But I wondered if you could reflect on when did you first engage this, even this label of health policy and systems research and the Alliance, and tell us a little bit more about how that has influenced your journey as a leader.
My journey took me from being a school doctor into, because of the employment process and us having to go in 94 into amalgamating multiple fragmented healthcare systems. And the irony is, one of my first experiences as a manager in that system was I was declared in excess because I was the last one into a school medical doctor job. And there were 6 of us, but there's only 5 posts. So by being declared in excess by accident, I became a manager. And that's where I started working with TB, HIV, with reproductive health, maternal child health, and all mental health, all of those together. And in that process, I actually came across quite a lot of WHO publications. I still remember the World Health Report of 2008, where they asked this question about how are you going to get good outcomes if you have a programmatic orientation. So I was always very keen to actually look at population health outcomes, what you achieve. So around about 2010, I came across the Alliance readers. And it really fascinated me because all of a sudden I got language to describe the discomfort I was feeling. Because I was feeling that programmatically and systems approaches doesn't quite gel for me. The readers helped me to actually find the language to say, system approach, this is how you do things, and all of those. So it was actually for me an introduction by the readers from the Alliance that I landed up with people like Lucy Chilson, with Helen Snyder and the colleagues that was in the field. And that gave birth to what is now known the Journal Club, that's been going since 2012 until now in the Western Cape. So I was introduced to the concepts, and through the Journal Club, it deepened my understanding of the concepts. It was really exciting because I was in a real world, almost trying to listen to the concept and apply it to my situation all the time. And it was really exciting to hear this new world of concepts going open. But for me, it never was a theoretical exercise. It was always about applying the concepts in my day-to-day reality of the work that I was doing. So your earlier question was, how is it that people at the front line are so conversant with this language? And the Journal Club has got a lot to do with it. We never had this engagement as a macro engagement only in our system. It was always a practitioner together with a mid-level manager, plus the senior managers coming together and having the concepts. So policy and implementation, power, leadership, governance, all of those things were intertwined in the way that we explored our relationship, and therefore the thirst and the hunger for more concepts to actually sense make together the challenges of our healthcare system while we were trying to build a learning orientation just kept the Journal Club going, because it kept the interest of the individuals that were involved going, and therefore also deepening the relationships of trust. So the big thing for us is we create the environment where people feel psychological safety. And I think that was the deepening thing of our relationship. And as much as all the work we've done, the one place where everybody gets together was the Journal Club.
Yes, I think the term Journal Club is a little bit too humble for this incredible process that you've participated in over many years and led. And when I listen to you, I'm always reminded of that Peter Drucker management saw, that culture eats strategy for breakfast. And when I listen to the way you talk about the way you've built your learning system, you've really prioritized culture and not assume that strategic plans or bureaucratic procedures are what are sufficient. It's really how do you build that culture, right? And this concept of psychological safety, I love that people can come together with safety to work together, to critique each other, to build. So from the past, let's turn to today. This is living in the present. You took on the role, Keith, of the head of health for the Western Cape in April 2020, just as the world was coming to terms or already struggling with the COVID-19 pandemic. But during that time, the department moved very quickly on innovations, didn't it? From delivering medicines to the homes of people living with chronic conditions, to using data to identify high-risk patients, to some quite innovative multi-sectoral interventions to protect health. How did that moment test your approach to leadership and evidence-informed decision-making? Were you able to preserve psychological safety in your system when people were panicking, when it was so challenging? And what did it reveal about the kinds of systems and organizational culture, that word again, that are needed to respond quickly in a crisis?
We did a review during COVID of why things moved fast and why we were very quick and responsive and adaptive in COVID. One of the things were that because we invested in what I would call system-wide, system deep, we did that investment prior to COVID. When the crisis hit, we had the ability to trade on the trust that we've created to be able to move fast, right? And to have trust and not people questioning what's happening. But at the same time, we had a very good bureaucracy. So the point is that our bureaucracy can deliver. So it's almost like when you add this brilliant mix of an organizational culture where people are free to speak, free to have the opinions, but free to actually also align to what is being needed, to the ability to deliver. And literally, when we put those two things together, that's why we were able to get to so many people's homes by delivering medicines to their homes in such quick time. That's why we could get a data system up and running that tracked in real time where the COVID cases were. And because we have all of those, for instance, just to bring the data part, we've built long relationships with the universities, and we have joint appointed staff that has been doing data work and research with us, and our data capability was invested. We could just pivot that data capability in a very quick time. So there's multiple pieces that was there in our system The crisis of COVID actually brought the pieces together. But the big thing was it required leadership to hold the pieces and to hold people.
I mean, that must have been a very challenging experience, as I think it was for all of us in public health in those first few months of 2020, with this unknown organism, trying to see what we could do and also think about what we couldn't do and to be honest about that, right? You've referred to it now several times, and it is a really important concept, the system-wide and system-deep leadership. Can you tell us a little bit more about that for the listeners? Because I'm not sure that will be clear to everyone. And perhaps you could apply that to the fact that you don't confine yourself to health care and the health sector. As you said before, from that early experience with education, you're passionate about multi-sectoral collaboration. And I suppose, what do you think that system-wide and system-deep brings to working across sectors in your setting?
So when you look back, it sounds all very curated and planned. And, so that's what I've learned about also taking systems lenses. I landed up being asked by my head of department to host these whole of society interventions in 4 prototype areas. And my first learning was, if you want to deal with social determinants as the key drivers for health and for well-being, you have to be very, very humble about the role of health in it. There's a tendency, the moment health comes in, we come with our professionals, we come with our experts. There's a sense from other sectors, these guys want to take over and they want to be in charge. So humility was the first thing I learned. And therefore, to find the common language in that, we actually found life course was the most common language with all sectors because people could identify with the life course. And therefore, in that interaction prior to COVID, I learned very quickly, same learning I had many, many years ago with schools. It was exactly the same approach. But now I was doing it at a system level across education, all the different government departments, police, municipalities, everyone coming together in that way. But I think probably one of the biggest things that I learned is to take this system-wide, system-deep approach. Because there was something about complexity and there's something about things being interconnected that was very clear to people, but it's very few people that have the appropriate language and tools for the sense making. But actually, if you take the system-wide things, which is the interconnection of all the pieces, that is kind of on the surface and we can do it and make it work. But the big value actually lies in going system deep. It's basically knowing where the underlying assumptions, beliefs, and mindsets and all the things go, which is where power lies. This is where relationships lie. And in a sense, when I stumbled onto system deep, I also found, but this is language for things that I've been trying to do all along anyway, which is to get rid of power, get people to trust one another, to create psychological safety and all of those. And again, you can hear it comes back to relational work. And I can tell you, Kumanan, I mean, it is an absolute pleasure to walk into a place that people, doesn't matter where they are and where they're from, have a connection with you and do not defer to hierarchy and authority. It's the most liberating thing for me. It is just a wonderful experience to sit with people and we are connecting as fellow human beings. So having our people challenging us and us not batting an eyelid, for us that becomes quite second nature. And it stood us in good stead.
I've had the pleasure to see that firsthand. I remember a couple of weeks ago, the emergency department physician who was so passionate while she was on her shift, taking time out of triaging her patients to explain what they are doing in both systems-wide and systems-deep approaches to address a very challenging patient load, which has doubled in recent years, very challenging systems determinants. And then I was with you when she texted you at the end of the day and she said, thank you for listening to me, right? You do live this sort of systems deep. I think the systems wide, people understand more. Across the health system, you need the system relationships, you need across other sectors. But the systems deep, I think, is something that people understand much less well. And it is about behavior, it's about culture, it's about respect, it's about that psychological safety. And it's been really interesting to see how you enact that and what that enables you to do in your health system. And now we can shift to the future. This is Leveling Up. A couple of weeks ago, we had the immense pleasure to be with you. You co-chair the Alliance Policymakers Forum, and you invited us to your house to see your system. And so we had policymakers from around the world. We come together once a year in person and throughout virtually to understand the challenges policymakers find in terms of strengthening health systems, in terms of using research, in terms of improving policy. But it was so vivid to be with you. And I think also for you, it was probably a mirror to your own system, seeing your system through their eyes and our eyes. One of the things that we did that was exciting is that we all went to Pretoria, and with the WHO country office and the South African Department of Health, we had a session on the future of the South African health system. And that's an area of work that the Alliance is very interested in. We have this Health Systems 2050 initiative. But this is something that you have been doing for some time. You've been reflecting on your past progress. Now you're looking at your system through to 2030. And you're about to look at your system through to 2050. What are some of the main issues you see for your system going through to 2050?
I'm working in such a high-functioning system that as the leader of the organization, I do not get bogged down in day-to-day crisis management. That's the first privilege that I have. I truly am allowed to look at the horizon. So one of the biggest things in 2014, we signed off the Vision 2030. And one of the things we've done now with our colleagues in health systems research in the Western Cape, they did a 2030 retrospective review of whether we've done in the last 10, 15 years what we said we will do in 2030. But we've moved on with them to say, let's do a prospective evaluation of whole system change, both system-wide and system-deep, as it unfolds towards 2030. We believe that is what gives us the flexibility to adjust as we go. It allows us to see the signals of the future arriving in small pockets before it's there at scale. Because by having created this environment for psychological safety, we actually give people permission to try out things, to do all kinds of things, all kinds of innovation. And I can tell you, we see pockets of, wow, this is something innovative, that's something there, something there. So it's literally like a flower bed with multiple little flowers popping up all over the show. And those seeds that comes out for us is a pointer of what is possible in the future. So we're very much connected to the present. That helps us to put our gaze onto the future. What have we found is the big drivers in this? The most important relational aspect to connect of trust and psychological safety is with the people we serve. And I tell you, the most rewarding journey we've had in the last 2 years is with civil society and looking at our challenges in those areas where it's very challenging together with civil society. And therefore, being person-centered, or in our setting, also being household-centered, especially to the households that's in the most vulnerable communities. That has been our biggest thing. So the biggest driver for us is to be connected with our households, to understand the needs, and to respond to the households, which for us is the next frontier in doing this work. We've used the PEPFAR money reduction, right? Where we had to repivot on how we deal with HIV and TB. And actually, we've just concluded a household community survey. But having done this household survey, it's community members talking to us, saying to us, this is our needs. This is where our needs intersect with social determinants, and this is what we require. It's a very powerful connection for us to have. So if I look to the future, Kumanan, the 2030 was always about being person-centered, being social determinants-oriented, looking at societal well-being, and looking at all the pieces of society coming together to actually give an intergenerational improvement. So you know that we've coined a strategic redirection of where we're doing by talking about start well, live well, age well in a system that's run well. We're taking on the life course as our driving force for the next 24 years to 2050 to say that actually intergenerationally, we want to make sure that everybody that's born in this province has a better future. And we can follow them through into them living well and them aging well. And that's what our colleague from Japan was raising out to us to say that, their aging population is one generation away for us. So we're embracing those long-term thinking, but doing it into our day-to-day practice. So as the futures unfold with relational work and agility and the work that we do for system-wide, system deep, we're preparing ourselves for whichever future might be emerging and putting the capabilities in our system to be responsive enough and proactive enough. Therefore, the questions are, what do we put our money into now? So then, hence, we are investing in reaching out to households, strengthening a community-based system around community healthcare workers, strengthening primary care to the level that's never been strengthened in our country, in our setting, then reorientating what happens in those emergency centers where specialist services are, and in our highly specialized services.
I have been in a room with you, Keith, where other leaders felt the need to say to me, oh, yes, Keith could do his thing, but he has a set of determinants and a system. But, that's not possible elsewhere. You've been quite almost positive or optimistic about what aid withdrawal means for reorienting your HIV programs, right? But what would you say to colleagues around Africa, around other parts of the world, around other parts of South Africa, who are really struggling with aid withdrawals, threatening vertical programs, service delivery, people literally dying, really challenged by the other concerns around the geopolitics, around war, around climate change? What would you say to them about this moment? Can they do what you're doing, and what is needed to prepare their systems, not just to respond to the crises of today, but really to anticipate the future?
We can tell you all the things that we've done to the data. We can track the data. We can track household. We can do outcomes. We can do cohorts and all of those things. And we can do all the interventions and all of those. But it's really underneath the surface where the answer lies. Because the overwhelming nature of the situation, the system is putting them into a short-term focus. You must invest in your own capabilities of actually trying to take a slightly longer view. Some people call it moving from scarcity to abundance. Some people look at it from a deficit approach to an asset-based approach. Whatever you call it, I'm saying don't operate from a place of fear, operate from a place of hope. And I'm really genuine when I say anybody in everywhere can do what we do. It is not some magic that we've done here. It is really just staying true to actually sizing up your options in front of you and resist the temptation of doing the short-term things that makes things worse for you. So that is the question that you're asking. So when we were faced with the withdrawal of PEPFAR money, we actually did relational work with civil society and said, guys, this is an opportunity for us to pivot to a sustainability orientation. We're now doing a real-time resource evaluation. We're looking at where it is. We're going to go into the household, check what our... So the thing is, my advice to others is that with humility and what you do, build relational work, get a group of people together and get your orientation. There is so much capability in our country, I believe, in every province that we have. The ability to do this work is just an absolute determination and conviction that this is the right thing to do. I do not see for any system, whether it's in South Africa or anywhere in the continent of Africa or anywhere else in the world, to be saying, take a system-wide, system deep lens, invest in the capabilities today that you need tomorrow, navigate your way through this. I can't see another way. And maybe people will say, well, we've been fortunate enough to do it, but it is hard work and it is dedication. And we have shown the results and we're starting to show the results on a much more sustainable way. So we're happy to work with people, not from a place of arrogance. It's from a place of humility and say, we're here and you don't have to take as long as we did. It can be much quicker because there's a lot of lessons of what we shouldn't have done, which we can actually assist and navigate you through.
That's a very inspiring message, which I'm sure our listeners will appreciate. I'm inspired myself, as I always am around you, Keith. One last question. Let's come back to your own future and the future of the Western Cape. You have all these innovations. You have the system embedded with health policy and system research, system-wide, system deep. And yet you have such challenging social determinants, right? In terms of violence, in terms of the commercial determinants, the drivers of non-communicable disease, many other challenges. And my question to you was, what would this health system deliver if these social determinants weren't so adverse, right? Because whilst you've made a lot of progress, you still have challenges. Your life expectancy could be higher. You have challenges both with communicable disease outbreaks and non-communicable diseases. So if you can envisage forward to 2040, what will health and wellness look like in the Western Cape, and how will this approach have really borne fruit in overcoming these adverse social determinants?
If society was not to the level of inequality and inequity that we have, I probably think that we would have less motivation to do what we did. There's something unique about being a South African. I'm proudly South African. I'm proudly living in the Western Cape. And there's something about adversity that brings the best out of us. And, it's this extremes. You've seen the wealth and the abject poverty right next to one another in our setting. And that's a powerful force of what I would call purpose in people that's attracted to work in this Western Cape Department of Health and Wellness system. And I can tell you, we have not lost the most skilled people. The most skilled people and the most motivated people stay in our system. And it is this absolute drive for social justice that keeps them in the system. It also shows us that with most adverse conditions, you can have the most triumphant results. I mean, you saw that same clinician in the emergency center saying that even with those adverse conditions, their survival rate and their ability to give people outcomes in that emergency center actually surpass most countries in the first world. That's what we're capable of doing in our system. So that brings me to what it would look like in 2040. The people I'm working with now, I see the passion, I see the commitment, I see the skills level, I see the capability. There's nothing that we can't achieve in the system that we are. It's taken a long time to get us here. So you asked me about 2040. I would welcome you to come and visit in 2040 to see the wonderful examples of how we have overcome not only what we can offer as a healthcare system, as how we can do it in partnerships with communities, in partnerships with private sector, in partnership with other government departments. Because our challenge, actually, from a health system point of view and a wellness perspective and well-being perspective, is societal inequity and societal well-being. I promise you, we will find the answers to turn some of this around. And our intergenerational survival and outcomes, we will triumph in this setting. I promise you, that is what is the single biggest driver for the people working in our system. And that is what keeps our system going and keep on attracting people to come into this.
Well, Keith, thank you so much. I look forward to taking you up on that invitation to come in 2040, but also I hope a few times before that. And I hope you can realize what our friend challenged you to reach the future that Japan has in terms of health, but also to learn from Japan, to keep that community focus, to keep all the assets that you have. It's not just challenges. And I think you're very conscious of that, and you're very inspiring to your team and to people working elsewhere on this. Before we close, is there anything else that you might like to share with our community? Is there a final thought that you could offer for our listeners?
I think, Kumanan, there's no better way to do this but to immerse yourself into the day-to-day reality of a complex health system. So my advice to people is get into a complex health system, connect with the people that works there, and embrace it, but become part of what the endless range of possibilities it offers for making a better future and a better society. I'm partial because my whole life has been about healthcare systems, but you really want to talk about societal transformation and change. I can't see anything other than a health system offering endless possibilities for making the world a better place for people. This is where purpose and connection is important. Find your purpose, connect with it, embrace it. Before you know it, you're part of something that is unforgettable, but it's also of true meaning to who you are as a human being.
Thank you so much, Keith. After listening to you, who could deny that the privilege to work on health systems, on health policies, is the most exciting and satisfying thing one can do with one's life? Your life journey very much proves it. And what I think you've really emphasized is humility. So avoid health imperialism with other sectors. acknowledge that we can't do this except together. And it doesn't matter how high you get in the hierarchy, you're at the top of the civil service for health in the Western Cape, but be open to criticism, be opening to listening to others, and that idea of psychological safety. So thank you for the leadership you bring, not just to the Western Cape, but to the wider health policy and systems community. And also thank you to the leadership that you bring to our work at the Alliance. For our listeners, if you enjoyed this episode, please share it with your network, especially those working at the intersection of evidence, policy, and practice. You can also join the Alliance Alumni Network on LinkedIn to stay connected and hear more inspiring stories like this one. Until next time, take care and keep doing the work that lifts others too.